Right now, health unions are now facing tough times ahead after the Ministry of Health backed down in remitting fees from health workers to their respective trade unions. This is seen as a move to strangle health unions by closing the purse strings that help them run their affairs in agitating for their members' rights. As our Health and Science reporter Beldeen Waliaula explains, the future of health unions now look very bleak.
Health workers' unions have threatened to take the government to court after the Ministry of Health, in a letter dated 22nd December by the Health CS Mutahikagwe to the Cabinet Secretary, Ministry of Public Service and Council of Governors, issued directives to not remit union dues. Arising from the consultative meeting held between Ministry of Health and Council of Governors on 21st December 2020, it was decided that with effect from this date of this letter, the Ministry and the county governments will not play an agency role of remitting union dues to the unions in the health sector.
The government has all of a sudden realized that the way to deal with the union is, one, to stop union reduction, two is to get unfavorable court ruling that goes against the unions, three is to intimidate the leaders with threats here and there, and just do things that in their mind will cripple the union. The government is better off with a vibrant union, because with the vibrancy it opens up our democratic space and allows participation of the citizen. But if you cripple that space, trust me, there will be always resistance.
The unionists say the vibrancy of trade unions in the country is undermined by those who don't follow the rule of law. If county governments do not remit union dues, most of the health unions will be unable to run their daily administrative issues and fund their strikes.
If there is any dispute, it will be handled in a manner prescribed within that document. Outside that, there will always be dispute, there will always be disagreement, and that's why you're seeing every day they strike. Every day they strike.
The KMPDU vice chair is unshaken by the uncertainty facing the unions in the health sector. He is not afraid of being crippled like their counterparts in the education sector.
The future of health workers is dependent on the rule of law. High-handedness will never take us anywhere.
This comes as the Council of Governors still insists that the health issues should be solved by specific counties without calling for a nationwide strike. Up until now, nurses and clinical officers are still on strike with no sign of white smoke. And as the health workers' industrial unrest goes on, COVID-19 continues to spread in the country. 83 COVID-19 infections have been reported in the last 24 hours out of 1,732 samples. The total caseload in the country now stands at 100,856. Recoveries in the last 24 hours are 29, 16 from home-based care, while 13 from different hospitals. 3 people have died, raising Kenya's death toll to 1,766. Beldeen Waliaula, KTN News.
Right, I want us now to take a short commercial break here on KTN Prime. We still have a lot more lined up for you, but quickly let's take a look at what we'll be waking up